Okay, so I'm going to be talking about this topic, continuing the theme that Mary presented so interestingly. I'll say a little bit about the broader context, but I think Mary's outlined that very well. The prevalence of social media. We'll think a little bit about clinical examples during the next 20 minutes, particularly around deliberate self-harm and anorexia nervosa, and some child protection issues. And I'd like to also think about solutions and some positive examples, because it's not all necessarily doom and gloom, before we conclude. I'm sure this looks quite familiar to many of you. I've got two daughters, aged 11 and 12, and they are often to be seen in this kind of pose, unfortunately. Instagram, Facebook, YouTube, Tumblr, etc. It's very ubiquitous, as you well know. It's all around us, particularly all around our young people, teenagers and younger, and that sometimes is a scene that may be seen, unfortunately, where people are not really looking each other in the eye. People are not really talking to each other as much as perhaps they could be in families. Families are not sitting around meal tables discussing the day's events or whatever. That, by the way, has been shown to be a protective factor for young people's mental health in one particular study. So people are sometimes seen in this sort of setting, which is, I think, somewhat concerning.